This is a great question and really shows what can show up after we've had a lot of changes in our pelvic floor. So I always like to remind people that in France, their healthcare system pays for every woman to have 12 pelvic floor sessions after every baby. So there's lots of other reasons besides just postnatal care that we need pelvic floor help. But we definitely need it after having babies, whether it's vaginally or through a C-section. Body work is so incredibly important for the healing process, and it's unfortunate that in some places it's just a given, and in other places here, people don't even know that this kind of work exists. But after a C-section especially, which is a major surgery, there could be a lot of scar tissue that shows up in the pelvis, especially after that scar starts to heal, and it can go all the way down into the uterus. And so one of the things that happens with scar tissue is it creates just a lot of tension, and it doesn't move as much as fascia can move. Even when there's fascial adhesions, they're really easy to break apart and create more of a sense of neutrality so your muscles can function better. But with scar tissue, it's even more difficult for it to go back to its normal range. And so having body work can really, really help. So what's probably happening, and it would be hard to tell for sure unless you had an assessment, but what's probably happening is the scar tissue that is coming where the C-section scar was is most likely creating a sense of pulling from deep at the center, and then that makes the patterning of the pelvic floor not as good as it could be. So it's not functioning properly most likely. And so what's happening is there's tension in some areas, and then there's not enough engagement in other areas. And if there's a sense of pulling, then the muscles around the bladder especially and around the uterus aren't able to engage as much, and that's what protects you from peeing yourself pretty easily or feeling like you really have to go to the bathroom or a lot of gushing coming out. There could be some other reasons, but it's probably a patterning thing due to the scar tissue. So the best way to get help for this is to find a body worker in your area that actually knows how to work with these tissues and knows how to work with the pelvic floor and also the fascia and the ligaments and the scar tissue around the pelvic organs themselves. So you can go to my website, gynochiro.com, to look for any practitioners in your area. We currently have people in Oregon, California, and Arizona. If you're in a different state than that, we're still growing, but you can look for women's health physical therapists and just find somebody that feels resonant for you. And if it's not working, regardless of if you're going to a chiropractor or a PT, make sure that you try other people if it's not working for you, or you find somebody that really feels very resonant with you. So hopefully this answers your question. Thank you for the question. It's really important, and it's so brave when we speak out about these issues that sometimes feel kind of embarrassing, but so many people go through them, and it's really important for us to all continue to speak about these kinds of issues that we usually live with in silence, because there are ways to help.